Okay. All right, well, welcome everybody to a special session of the C20 to G20 meetings in India. We're so glad to have the opportunity to be with you today for this session entitled Planetary Health as a Framework for Action. And we've been asked to assemble a world-class group of leaders in the field of planetary health to share some perspectives around how the planetary health framework informs the kinds of actions that are needed around the world to address the moment that we find ourselves in. My name is Sam Myers. I am the director of the Planetary Health Alliance, an organization that's based here at Harvard University, but that is a coalition of organizations, over 350 organizations in 65 countries that have come together collectively to grow the field of planetary health and to mainstream its central insights into action in policy and practice. And the C20 meetings reached out to ask the Planetary Health Alliance if we would help in convening this group. I'm joined by enormously distinguished leaders, including Dr. Mandeep Dhaliwal, who is the director of the UNDP's HIV Health and Development Group. Dr. Dhaliwal brings to the organization over 20 years of experience working on HIV, health, human rights, and evidence-based policy and programming in low and middle income countries, and has become a really forward thinker in how planetary health informs that work. Dr. Jamila Mahmood is currently professor and director of the newly established Sunway Center for Planetary Health in Malaysia. She was the special advisor to the Prime Minister of Malaysia on public health from April 2020 to August 2021. She is also a member of the government of Malaysia's Economic Action Council and Climate Action Council, and has numerous other engagements, is also a really critical thinker and leader in the field of planetary health. And finally, Dr. Courtney Howard is an emergency physician in Yellowknife in Canada's subarctic, is a clinical associate professor in the Cummings School of Medicine at the University of Calgary. She is a nationally and globally recognized expert on the impacts of climate change on health and on the broader field of planetary health. All three of these physicians have been engaged in planetary health for many years and are some of the brightest lights in the planetary health constellation. So it's wonderful to have you here. Mostly this session is going to be really highlighting your voices. Before we get into some of the questions that the C20 organizers posed to us at the Planetary Health Alliance and get your thoughts about how planetary health as a framework leads to action, I want to just provide a little bit of an introduction in what the field of planetary health really is. Where does it come from? And how did we sort of, how do we frame and understand the moment that we're in? The sort of core premise of the emerging field of planetary health is that the scale of humanity's ecological footprint has ballooned so much over the last several decades that our planet no longer has the capacity to absorb the wastes that we're producing or provide the resources that we're using sustainably. And as a result, our own actions collectively are transforming not only the climate system, but also driving the sixth mass extinction of life on Earth, creating a global scale problem of pollution of air, water, and soil, transforming landscapes and oceans, and driving scarcity of resources like fresh water and arable land. and that all of those human-caused global scale environmental changes are interacting with each other in complex ways that are affecting the foundational conditions for human health, the quality of air we breathe, the quality and quantity of food that we produce, our exposure to infectious diseases, our exposure to extreme weather events, even the habitability of some of the places that we live. And as a result, we are seeing growing burdens of disease across every dimension of human health. So the central sort of insight of the field of planetary health is that this Earth crisis that we've been aware of for some time has reached a scale that it's now driving a humanitarian and global health crisis. And that if we want to secure a livable future for humanity or the rest of life on Earth, we need to transform the way we're living to reduce that ecological footprint and to protect and regenerate our natural life support systems. And so we have many cousins in this field. Eco health, One Health, planetary health are all working on related issues. We're all putting our shoulder to the same wheel, which is this fundamental conviction that we won't have a livable future if we can't find a way to protect the natural life support systems that we all depend on. And so we appreciate all of our cousins in these other areas, and we're very, very happy to be with you today. With that, let me start with a question for Mandeep, which is, how do you think that planetary health as a framework informs interventions needed with a particular focus on the policy domain?
Wonderful. Thank you, Sam. And it's really an honor to be here with you and our distinguished panelists, and to have an opportunity to address the C20. From a development perspective, which is where I sit in the UN's largest development agency, we focus on a range of issues, but it's become increasingly clear to me over the years that the solutions for the health of the planet and the health of people are fundamentally interconnected. And we see this in the Sustainable Development Goals and the pledge to leave no one behind, the call for integrated solutions, which all member states, 192 member states, signed up to deliver on the 17 Sustainable Development Goals, which are all interconnected. We have a goal on health. We also have a goal on water. We have a goal on responsible consumption. We have a goal on inequality. The health goal extends to well-being as well, which is really important. So I think the understanding that single siloed solutions were not getting us very far, given the challenges we were seeing in terms of sustainable development and delivering on the promise of sustainable development for everyone, everywhere, and really keeping equity at the center was not possible without integrated solutions. So that's where my reflections on planetary health really kind of started, that this was a framework that allowed us to have that conversation. How can we do things in a more integrated way? Now, the interconnection, even before we got to the SDGs, there was an understanding that actually the three sort of traditional strands of development, social, environmental, and economic development, were all intertwined. And you had to address all three if you wanted to get to sustainable development. So just kind of as a framing about where the integration piece comes from, I think is really, really important. So for me at UNDP, we are focused laser-like and laser sharp in helping and working with our member states, learning from them, but also helping them to look at how do we scale these kinds of integrated solutions that get us to the systems transformation that we need. You just have to look around these days to see how many crises we have, in terms of, and you outline some of the environmental ones, water scarcity, the changing food systems, urbanization, the accelerating climate emergency, and all of these impact health. They impact the rising burden of non-communicable diseases. cardiovascular disease, diabetes, infectious diseases are increasing. We've got emerging infectious diseases. We have old infectious diseases emerging again. There's a mental health crisis that's risen to the surface, accelerated by COVID. There are issues with malnutrition. And I think the humanitarian piece, which you outlined, is really important. We have more and more people on the move, more and more displacement. And all of these issues together, this interconnected impacts of the health of the planet and the health of human beings, really have an integral impact, I think, that we need to think about in terms of the health of the planet. And you made one point, which I think is really important. This is human caused. Human beings, we all contributed to this. But I think, if you look at the latest report, which came out on the climate crisis from the IPCC this week, or last week, I should say, and you look at the UNDP Human Development Report for 2022 on uncertainty, we see that actually it is within the power of humans to also turn things around. And I think that's a really important message. So this conversation about the importance of planetary health as a framework to be solution-oriented is very, very powerful and very compelling for me on both a personal and a professional level. The focus on health equity that I see from this framework is really important. All of the things I described, non-communicable diseases, infectious disease, mental health, all in nutrition, all of these disproportionately affect the poor and the most vulnerable. And we've seen through COVID the last few years, a rise in poverty. The metrics are all going the wrong way. Life expectancy dropped 2 years running. That hasn't happened for years. So I think, the systems approach from Planetary Health helps us to think about how do we do things differently. And there's a term, Dart, that's going around now called polycrisis, and it's all about interconnected crises that are very complex and challenging to address. And I've been thinking about planetary health as really, it's been at the top of my mind that, the way out of interconnected crises is not to address one crisis at a time. The way out of interconnected crises is to find the kind of systems transformation solutions, the integrated solutions that we need to help us move out of these crises and to recover in a way and change things in a way that we don't have that kind of vulnerability we reduce our vulnerability to these impacts. So I'll give an example. During COVID, for example, there was immense amounts of healthcare waste from PPE, vaccination programs, and I think there's an opportunity, and we've seen through UNDP programs of how to manage this waste in an eco-friendly way. So there are things that we can do, reducing waste, reducing emissions in the health sector, which improve health, but also improve the health of the planet. And I think those are the kinds of win-win solutions that planetary health helps us think about. How do we reduce plastics pollution? How do we conserve water for better health? For me, this is a framework which will allow us to be better prepared for the future. At the United Nations, we're planning for what the Secretary General has termed the Summit of the Future. And in that Summit of the Future, it's really we're looking at what are the kinds of solutions that can help us emerge from this crisis stronger, and stronger in a way that helps us to protect the planet and protect the health of human beings as well. And I think those solutions will come from a planetary health framework. The metrics have to be all about equity. They all have to be about health equity and increasing equity more broadly in the world. Because if we don't start with the poorest and the most marginalized, and this is a critical part of the promise of the SDGs, we won't be able to achieve the progress that we need. So, just to wrap up a little bit, I think this is the Planetary Health Framework is a framework of hope. It's a framework that's critical today in terms of how we emerge from this polycrisis in a way that is effective. How can you address pollution, for example, or how can you address, lung disease or lung cancers or cardiovascular disease without addressing pollution? So I think this is the way that we can really we can emerge from the problems that are partly self-created, and in a way that allows us to do things differently. And I know my fellow panelists will talk a little bit more about some of the other aspects of solutions. But from a health perspective, I really feel that these integrated solutions that address key environmental and climate issues that are clearly impacting health is a way for us to build a world that is protecting the health of the planet and the health of people. Thanks. I'll stop there for now.
Fantastic. Thank you so much, Mandeep. So very quickly, what I heard was it's an integrating framework that allows us to address different dimensions of the polycrisis simultaneously, which is critical. It emphasizes social justice, which is also critical. And it provides a sort of aspirational framework for where we're trying to go that brings hope. What is the transformation we're seeking? I want to turn to Jamila and ask, how can we achieve collective results under the Planetary Health Framework with powerful calls to action for the G20 in India, but also leaning into the G20 meetings coming up in Brazil and South Africa?
Thank you very much, Sam. And I reiterate what Mandeep has said, that this is a tremendous opportunity, C20 to G20. So really huge thanks to the organizers for giving us the space for discourse. I think your question is so important, because at the end of the day, we have the evidence, we have the science. We are not short of evidence. I think, all the work that has been done by scientists and policymakers around the world to bring that evidence to the fore now needs to turn into collective action. I think this is where the Planetary Health Framework helps us, the Planetary Health Alliance, and others who are working on planetary health. Maybe they don't term it planetary health, but certainly, the approach is through a Planetary Health Framework, which is a multi-systems integrated way of doing things. And I think in terms of the communications, here is where I think one of our challenges lie, and that how do we ensure that the evidence and the science does not just sit in an echo chamber with scientists and policymakers? How do we turn this important evidence into communication pieces that speak to people? Because as you've been pointing out earlier by both of you, that health, the determinants of health are very much environmental, social, but also behavioral. And things that will make people change behaviors will be when they acknowledge and they internalize and they identify with the problem, and they identify that it also could happen to them or has happened to them. And what a tremendous opportunity, because we've just emerged from the worst, pandemic in our living history, and use that memory and that recent memory to say we've got to do things differently and we've got to do things better. So I think first, as I mentioned, is a communications part. How do we build narratives that are clear? How do we tell also stories not just of doom and gloom, but also of hope? I think that people are exhausted after this pandemic and exhausted with climate change and all the reports that are coming out. How do we now tell stories and collect stories from around the world that have shown that even a small group of like-minded people can actually do things? And I think we need that inspiration. So the campaigning element is going to be important, but also the collective, collaborative approach is critical. So as a part of the Planetary Health Alliance and movement, we have a regular Planetary Health Alliance, Planetary Health annual meetings done almost every 18 months or so. And I think, we're very fortunate to be hosting the next one in Malaysia in April 2024. But what we're doing now is actually build a year of activation where we are using the regional partners and members of the Alliance and the hubs to actually address some critical questions from evidence to action. How do we confront reality? And we're looking at it from 4 areas. One is looking at what kind of governance will be required to shift the way we do things. Secondly, what kind of communications is required to actually build that narrative and build that inspiration and alter behaviors and decision making. Third is, what is the education revolution that's required for us to ensure that people understand what we're talking about, and young people who are already taking responsibility even more than adults, I would say, really being sensitive to that future they're going to inherit. How do we help the younger generation? How do we help the older generation? Intergenerational learning and that education revolution I call. And fourthly, how do we bring businesses into this? I think we can't leave businesses out. I think that it requires all systems to operate and all stakeholders to really, play their role. It's not going to be easy. It's disruptive. It's uncomfortable. It's about doing things which are not the usual way you do. But, it requires us to look at economics differently. It requires to look at development in a different light. So if I can share my very humble experience, we are only barely 2 years old, but even in that time, we've been able to advocate, lobby, campaign, and convince and dialogue with our government. And planetary health is specifically mentioned in our 5-year development plan, from 2021 onwards, 2022 onwards. And the second thing that is being done is that the government has tasked the Academy of Science to work together with other stakeholders to come up with a planetary health action plan to be presented and discussed whether we can adopt such a plan. So it's about being pragmatic. So I think civil society has a very important role. I know I'm addressing a C20 group. I think where we need to improve is our two-way communication. How do civil society actors tell the scientists what they need in a way that will help them? And how do scientists react to what the needs are of society in terms of the evidence and the communications as needed? One great example I must cite is the recent UNFCCC summary report, where it has a fantastic visual and infographic that places you at the time of your birth and what kind of future you're going to inherit in terms of climate. I think we need much more, visuals like this. And so that, someone who is 90 years old or someone who is just having a newborn child can be able to look at that and say, my goodness, this is the future my child is going to inherit. Or a grandfather saying, this is the future my grandchild is going to inherit. So I think, we can work around these issues. There are many other examples of how countries are using models like donut economics that are going to look at, regenerative economics that's going to help build that equity, that system that will allow people to thrive, but also the planet to thrive, being cognizant of the planetary health framework and also the planetary boundaries, which is so clearly outlined in the donut economic model. And again, they're sister concepts, they're cousin concepts, just like planetary health with One Health and others. Donut economics is a cousin concept to circular economy, other new models that people are looking at. So we have a lot to do. We don't have that much time. And I think this is a fantastic opportunity, a springboard for us now. And I do hope that, those of you who are interested in the annual meeting will look up at the website of Planetary Health Alliance, but also don't forget, this is not going to be there's going to be another one in the next year or so, another one after that. So we can continue to build that momentum on advocacy and campaigning.
Thank you, Jamila. That was amazing. And loud and clear, what I heard most was that it is about being pragmatic and the need to move from evidence to action. And we're so grateful to you and your colleagues at Sunway for your leadership in creating the next big Planetary Health annual meeting. And I heard an invitation to anybody at the C20 meetings to see that as another milestone in this pathway towards future G20 meetings and to really tackling this critical question of how we take the critical sort of insights and knowledge that are coming out of the field of planetary health and transform them into action. So that is fantastic. Let me turn, last but not least, to Courtney, and ask you, Courtney, if we use a planetary health lens, how does it change what we emphasize that we need to do? How does it, speaking to Jamila's emphasis on the pragmatic, what does the lens itself suggest about the actions that we need to take?
Yeah, thanks. So my original training is in emergency medicine, and emergency doctors are all about having somebody come in and listening to their problems and then figuring out a plan and starting that plan. And so I find that as I've started to integrate the planetary health boundaries framework into my work, I almost think of it as systems that continue past the organ systems that I usually think about as a physician. So as docs, you always think, how's the heart system doing? How's the lung system doing? Well, now I think to myself, okay, well, how is the climate system impacting my patient? How is air pollution impacting my patient? And in fact, within medicine, I'm part of the Canadian College of Family Practice. We have a responsibility to advocate for healthy public policy on behalf of our patient population. So this is part of my core work. And I just happen to provide care for patients who are in one of the ground zeros of climate change. I've been an emergency physician in the subarctic and Arctic in Canada for 15 years now, living there for the last 12. And so some of my patients are already coping with temperatures 3 degrees Celsius warmer than they were when an 80-year-old elder was born up in the Inuvialuit areas in the Mackenzie Delta. And so it was clear very quickly that that was impacting people's health. I would be stitching up people's scalps and say, well, how did you go through the ice? And they would say, well, I was on my way to my trap line, and the ice is usually stable at this time of year. And I got halfway across the river and the ice gave way and my snow machine went through and I got catapulted over to the other side of the river and the shards of ice cut my scalp. And so that's why I'm now sitting there stitched. So it has impacts on the safety of ice-based travel. Our cold weather drowning rates are going up, food security, as you can imagine, accessing traditional foods, mental health and cultural sharing practices. So these were all reasons that I felt I needed to do something. And what I've found as I've moved from the local to the national to the global is that those patients' stories really resonate with people. And so the ability that frontline clinicians and decision makers have is to take those stories of really lived experiences into boardrooms and create change. So it was really that incentive for me that led me to lead an initiative at the Canadian Medical Association to have them divest from fossil fuels. And that matters. The Canadian Medical Association is a multi-billion-dollar NGO. And that sets a precedent in terms of saying, hey, fossil fuels are not healthy for us and for our children. We also had a very bad summer of wildfires in 2014. And so looking at the planetary boundaries framework, we're talking about atmospheric aerosol loading, air pollution. And in fact, there was a Tuesday where almost every single patient I saw came in with an asthma exacerbation, and they were hard to get out of there because they had so much inflammation in their lungs. Usually you give people a few puffers, they feel way better, they go home. But by then it had been 2 weeks. And so it took a very long time. I had to give them steroids. I had to wait until they got better. And it was enough of a red flag that we started a research project into it. So we had 2.5 months of wildfire smoke. And when we published the paper, it was one of the worst exposures in the literature base. And we showed that we had a full doubling of asthma exacerbations. And it mattered that we did that work because that study has gone on to be part of the Canadian contributions to the IPCC report and to the Canada's National Adaptation Strategy development. I was the only doctor on the disaster and risk reduction table there and was able to bring those patient stories into the targets that we eventually came up with on a national level to help us adapt to these impacts we cannot now avoid. So thinking about clean air shelters for all of our patients, thinking about recreation facilities being open for free, automatically during wildfire season so people can exercise and see their community. So really connecting what we're seeing on the local level to global and national processes, and connecting that research that we can do to policy and advocacy processes is really important. The health community has also been key to mobilizing the World Health Organization on the call for a fossil fuel non-proliferation treaty, which ended up, we heard from the treaty people, being really key to countries starting to sign on to potentially the start of a new international process for fossil fuels. So I think that there's a ton we can do when we really almost start to think of ourselves as being, as we know, as Indigenous community members have taught me, part of the living world, part of nature, in relationship with elements of nature, not in dominion over nature. And it changes the way we work. And as a healthcare practitioner who helped take care of an area that is actually bigger than the size of France and Spain combined during the pandemic, I mean, that was hard. And I don't know any bedside clinicians who aren't feeling burnt out right now. But in fact, one of the only ways I've ever found for giving myself permission to take care of myself has been since I started looking at myself as part of nature. And if I want all of nature to thrive, I need to thrive too. And so inviting that care into the space within healthcare itself, I think, is also really powerful because it brings a more well human into those spaces, whether it be at the bedside or more broad, so that we can do this work in community, which is what we need to do in order to assure a healthy future moving forward.
Thank you, Courtney. Amazing. And really, really interesting insights. It seems like, in response to this question about how the planetary health frame changes what we do, part of what I'm hearing is it changes who we think we are. It sort of brings us back to a conception that's already very prevalent in many traditions and Indigenous peoples' knowledge systems, that there is this interconnectedness, that our organ systems extend outside of our body, and that therefore there's a caregiving that's required beyond the personal, but to the entire ecosystem of life support systems that we depend on. And so it's that broader frame, and also it's a lens that allows us to see things differently, is what I'm hearing. And that when we see patients coming in with common diagnoses, whether it's Lyme disease moving north in New England, or respiratory disease in response to wildfires in the Arctic, it's recognizing that these things are connected to our own activities and our own transformation of our planet's natural systems, and then advocating as health workers for the need to protect those systems as a central core element of the jobs that we're being asked to do. So really interesting insights. We have a little bit more time here, and so I don't know if any of you have specific questions for each other. I have a few questions if you don't, but Mandeep, I see you coming off mute, so I'm hoping you might have a question or a statement.
More a comment, really. I mean,
Great.
I think, from the UNDP perspective, obviously we work in close partnership with WHO and other of the health actors working, and governments, obviously, working on these issues. And increasingly, we're trying to link our climate and environment work with our health work ourselves, and encouraging governments to do that. I really like Jamila's framework of governance, communication, education, and bringing all sectors to the table. That multi-sectoral governance is critical. From UNDP's perspective, we look at the determinants of health, social, environmental, economic, and looking at sectors outside the health sector who are really critical to driving health outcomes. And we know that, over 70% of the factors that influence health are outside the purview of the health sector per se, in terms of policy control. So I think this point about multi-sectorality and effective multi-sectoral governance for health in a world where, it's obvious now that, the health of the planet and the health of humans are intertwined, that multi-sectoral governance is really, really critical. And there's always a balance that has to be achieved in terms of what's in the public interest and what's in the private interest. So private sector is critical, obviously, but I think looking at making sure that health and public interest and the health of the planet are driving those conversations, and are kind of foremost in our mind in terms of the multi-sectoral governance that is needed in a planetary health framework, I think will be critical. So I'll stop there. Be interesting to hear Jamila's reflections on the governance that's needed, because that's a huge part of UNDP's work, and it's a great opportunity to learn from Jamila, who's doing this in government, who's advising government in Malaysia. How are they dealing with this governance issue? Thanks, Sam.
Yeah, no, that's great. I'd love to hear Jamila have you jump in, and if you have any further reflections on some of the Donut Cities work that you were mentioning, that might be interesting as well.
Yeah. So just as for the record, that I'm not advising the government on economics anymore, but more on other things now. But nonetheless, just from my experience, I think the most important thing is that, governance must be seen as multi-stakeholder. I think a lot of the time, when you think about governance, you think it's a top-down governance. And I think, in this day and age, the participation of communities and people is really the most critical part of governance. So I want to tie that to a very recent example. I was in Birmingham just about a week ago, visiting something called Civic Square, which is a donut economic project, which is fantastic. And I really encourage people to look at, because it starts with bottom-up governance. It's about conversations with communities, not even mentioning planetary health initially, but later on, they understood it. They understood donut economics, they understood the planetary boundaries, and the communities themselves started to self-organize, for Birmingham, what they think is a place to thrive for themselves, their families, and for the planet. So it's little, community buy-in and participation, and then helping to drive some of the discussions around what policy changes need to happen for equity, for economics to thrive, and so forth. And I think that, our experience here as well, coming out of the pandemic again, it's such an opportunity, because almost every country we know is probably suffering the consequences of the pandemic. And it now puts a big highlight, a spotlight on health, that without health, your economies will be affected. Social fabric is, ripped apart sometimes. And there's mental health challenges, there's challenges with all sorts of things. And yet, coming out of the pandemic, I don't know if it only happens here, but we see people behaving as though there was no pandemic, right? You see more cars on the road, you see the pollution increasing. So the memory is so short. And we need to continually remind people through advocacy, through campaigning, through stories, that let's not go back there, right? And some, I think earlier you mentioned biodiversity, that look at what happened at Montreal, that people came together and said, okay, we want to have, 30 by 30. And it wasn't just governments, it was civil society working with private sector, advocating with governments to say, we need to change the way we do things. So what it tells us is that when there is political will, when there is community participation, when the business sector also buys in, change can actually happen. And this is the kind of disruption we're talking about. So I want to maybe add one point. Courtney was just brilliant in explaining the real life situation. But I think one of the things we must recognize, that globally we have a trust deficit, right? There's a lot of mistrust right now, and that's fueled by also communication, social media, that is, a lot of misinformation, disinformation, not happening, not just in health crisis, but in everyday things, from the climate, from economics, everything, right? So I think that where we need to recognize is that, and I speak as a doctor myself, that, we are so privileged as health workers to be very trusted. I feel it's a huge responsibility, and I take on planetary health because I feel it's a responsibility for us to be in trusted positions, to use our voice and our experience and our expertise to speak to policymakers, to speak to decision makers, to speak to the public about the fact that we are in a serious planetary crisis. And, we have to do our best.
Thank you, Jamila. I want to go a little bit off script here and reflect on something that you just said about the need for bottom-up governance, about the dangers of sort of misinformation and the trust deficit, the need for multi-stakeholder governance. And think about our audience at the C20 meetings and the importance of civil society organizations, which you mentioned earlier, as opposed to sort of formal governments, and ask whether there isn't one other dimension of this conversation that we haven't fully explored, which is the need for movement building and collective action. And that if you truly want sort of bottom-up governance and you want stakeholder empowerment, that it doesn't just happen, that there's actually a whole process and science of empowering those people and bringing them together and building movements. And that I think somebody like Marshall Gans would argue that many of the planetary health challenges that we face globally are not knowledge problems. You started out saying we know enough, right? But they're power problems. They're problems where you have entrenched interests, whether it's fossil fuels or other extractive industries, that have actually contributed to misinformation, that are benefiting from the processes that are degrading our natural systems, while future generations bear the burden. And if you want to confront power problems, you need to build power, and you need to push governments and push the private sector to do the right thing. And I want to turn to Courtney, who I think has given a lot of thought to this area of movement building, and just ask Courtney if you have any sort of reflections on this topic as a final dimension of the conversation.
Yes, thanks. And everyone on this call is an incredible movement builder. So I just want to acknowledge that. I'm at Oxford right now at the Blavatnik School of Government, and I'm studying for my exams right now on the politics of policy making. And my take home from that entire course is that the most organized group wins. They pretty much just said that straight out. And so that's a real paradigm shift for those of us who grew up super nerdy in the sciences, I think if you'd asked me 20 years ago, I would have said the group that has the most evidence-based approach wins. And I think we've been operating broadly with that as our default assumption, that if we told people things, that those things would happen. And it completely is not aligned with anything from the behavioral sciences or the social sciences. And so we need to really move from that evidence deficit or information deficit model of change making to one, I believe, that's based on the iterative achievement of concrete targets, starting at the micro level, so the individual level, moving as you build people to the community level where you can change institutions in your community. And the thing about those is that now you've potentially got a hospital with solar panels on it. We know that solar panels actually go viral once people see them, they're catching. All of those good practices influence other people, and you start to shift policies and shift norms and shift investment in a way that gets magnified up to the national and international level. And so I'm really interested in how can planetary health actually start to contribute to the science of movement building? How can we do way more research on how movements get built and how can we most productively communicate to different communities? Because that work right now, it doesn't have a very strong place. Civil society, in my experience, works with so little resources compared to anybody else. So what if we redirected resources on a massive scale towards the people who are doing the work of building that power, of bringing people together, of creating and sharing narratives, of creating those concrete changes on all levels? I think that's actually the key step we need to make right now to create a healthy future.
Amazing. Thank you, Courtney. We're beginning to come to an end in terms of time, but I want to ask each of you for any sort of final closing thoughts. And I know Mandeep had a couple of thoughts about the movement building topic. So let's just go around and see what closing thoughts everybody wants to share, and then we'll bring this to a close. But let me start with Mandeep.
Yeah, just to say, I mean, I fully agree with Courtney. I think there's a real need to build movements, and just picking up on something Jamila said, it's really multi-stakeholder movement building. So we need to bring together movements of, the climate activists with the health activists, with, the activists on, biodiversity. So it's that kind of movement building that's gonna move things. And there are a lot of lessons from movement building around gender equality, around HIV, where we can draw on those lessons. We don't have to reinvent the wheel. But I really think this multi-stakeholder building from the bottom up is really, really important, and movement building is critical to that. I would say one thing, politically, we live in a very, geopolitics is very complex these days. And I do think there needs to be attention to the fact that civic space in many countries is shrinking. So we really have to make, I think, some very proactive efforts, like what Courtney is proposing, to support civil society, to do the really important work that they're doing across, different subjects, different topics, and particularly young people. I think that youth activists have a completely different way of looking at things. And their vision is, I think, the vision of the future. It's a vision of looking at they see the interconnections in a way that's very powerful. They don't come from this legacy of siloed ways of individual discipline ways of working. So I think if we can really energize movement building with bringing young civil society, youth voices into civil society and supporting them, I think that would be really, really powerful. I'll stop there. Thank you, Sam. And thanks to the panelists. It's been great listening to everybody.
Wonderful. Thanks, Mandeep. Jamila, any closing thoughts?
I think just to build on what Mandeep said, which I wholeheartedly agree, as we talk about, planetary health and the need for a multi-systems approach that breaks silos, I think even in movement building, we need to break silos. I think too many times, the leadership in movement builders will tend to focus on only one thing. I think planetary health offers this overarching framework where you look at, the state of the planet, the state of humanity, and everyone actually has a role. And how do we then, really avalanche into a movement, avalanche where everyone actually has a role and contributes to this planetary health framework, because it really, at the end of the day, is about an existential crisis. And I think I always say to my friends and my students and young people that when we talk about superpowers, the only superpower in my mind is the superpower of people and communities and movements. So, never underestimate what civil society, civil movements can actually do to change history.
Fantastic. And any last thoughts, Courtney?
Well, I would just say that in my experience and also in the literature, I just looked into literature on eco-anxiety in youth last week, and everything aligns to say that when you're taking productive action in community, it feels good. You're not lonely anymore. You've got friends. You're not aimless anymore. You have a goal. You're working towards a positive future in alignment with others. And that goal itself actually helps to align people who are coming from different areas. So I think a shared goal of well-being now and into the future as a North Star, it gives us all a place to start walking towards, and then we'll meet other people along the pathway that are also going to the same goal. And that goal itself helps us with the movement building. And so I've met some of the best friends of my life doing this work. I've certainly learned things I never would have learned before. And I think that at this moment, we have the potential not only to impact health now, but for all future generations, and live a really rich life, each of us ourselves, as we're doing it. And, what better way to spend a life?
Beautifully said. So really, we go back to what Jamila said at the beginning about the need for sort of an aspirational narrative, and what Mandeep said about hope, but that coming together in collective action with an eye toward a bright future that we have outlined and can see. And that's, I think, a critical piece of work for all of us going forward, is to make clear, as Jamila has emphasized, and to communicate the bright future that we can create if we come together and engage in the right kinds of policies and practices. So what a thought-provoking session. Enormous thanks to Mandeep Dhaliwal, to Jamila Mahmood, to Courtney Howard, also to Marie Studer, who's been behind the scenes and helping to organize this panel for the Planetary Health Alliance. And so with huge thanks to all of you and to the C20 organizers, we'll bring this session to a close. Thank you so much.
Thanks, everybody. Thank you.